everyone, and welcome to today's lesson. In this session, we're going to discuss how we identify and treat hypertensive emergencies in the ED. We need to remember that a patient's blood pressure reading is simply a number. Yeah, that number can tell us things, but the number alone doesn't truly indicate our patient's status. We've probably all seen those patients whose baseline is hypertension, right? Now, this doesn't mean they are having an emergency, but when they begin to have organ dysfunctions, then it's an emergency. I think it goes without saying, if we're worried about hypertension, get a blood pressure, right? So we want to keep a close eye out for organ dysfunction. With the thought of cerebrovascular impairment, or HEAD, right? We might see a headache. We can see some changes in their level of consciousness, which might manifest sort of as confusion and possibly even seizures. If we're thinking about cardiovascular compromise, or heart, for people who wouldn't understand. With cardiovascular compromise, we could have chest pain, and we can have changes in the 12 lead, like T-wave inversions and even ST elevations, which we all know would indicate myocardial damage. We might also see symptoms of heart failure with these patients, and if you want to know what those might be, there are a lot of awesome lessons here on nrsng.com, guys, so feel free to take a deep dive into our heart failure in our med-surg cardiac units. So we want to look at the eyes. Are they bleeding? Now, I don't think I have to tell you that bleeding from the eyes is never a good thing. We can also have something called papilledema, which is usually caused by the increased pressure of the hypertension. Now, be aware, guys, if the patient starts complaining of any blind spots in their vision, it's usually an indication of that papilledema. As things progress, it might get down to the kidneys. If your PCA brings you a urine sample that looks like this, it might send up some red flags. Well, no pun intended. Gross hematuria, like this, is not a good sign for any patient. But if you couple that with hypertension, you can probably infer that the kidneys are being damaged. On the other end of the spectrum, if they're not putting out any urine, that's also not a good sign.